This actually goes back a number of years, and I was once asked what was the most unpleasant thing I have to do in my day-to-day job, and it was really to numb up patients in clinic with a lidocaine drip, and it's what we've done for years. We all do that. It's really an unpleasant thing for a patient to go through, and for me to witness as well. It just kind of hurts me to watch this happen. You know, we had an opportunity to try a new system that was designed to, instead of the drip, replace this with a mist so the patient wouldn't react to it. The drip causes is a lot of coughing, choking, and we felt like with a mist system, the patient could get their numbness without having to go through all this unpleasantry. It's been a game changer for sure. It doesn't take much convincing to get the patient interested in this device. Many of our patients have had multiple procedures in the past with the standard drip catheter, which is fairly unpleasant as we discussed. And I tell them that the new system that we have will not involve any of the coughing and choking. They may feel a mist, some of the mist, they may taste the lidocaine as we're administering it, but the problems with coughing and choking are really, for the most part, eliminated. And pretty much every patient that is told that wants to try the new system. So we've really had a lot of success in converting people over from the drip to the new mist system. For somebody who's used to a traditional drip catheter technique, most of us usually start dripping. Sometimes you can start dripping immediately on the glottis and have them sort of cough and aspirate, and they'll cough it up onto the epiglottis, and you don't necessarily have to drip it directly on the epiglottis. On the other hand, with the system, the mist system, you really do need to begin painting the epiglottis. You want the numbing of the epiglottis to occur before you go down to the glottis. Since you can see the stream, it is very much, anybody who's ever spray painted anything kind of knows what that mist looks like, and basically the idea with painting, what I mean when I say painting, is kind of in a systematic way going over it, one coat at a time. And if your light settings are altered, where it's washed out, it's too bright, or it's not been white balanced, you may not be able to see the mist. So it's important to make sure your lighting settings are in their normal detent position. So you would start kind of across the epiglottis, get as much as you can of the laryngeal surface, and just kind of move your way down towards the false vocal folds. But it has to be a systematic approach of painting the entire supraglottis little by little as you go down towards the glottis. Really what this system represents, a numbing system that gives you all the options that you would want. Because although it is primarily based on delivering the mist, which gets the majority of patients numb, there's some a little bit more difficult to completely anesthetize. And the nice thing about this system is it includes a side port as well, that you can put a catheter through and do your traditional drip. So this is just the same thing, sir, just delivered through a drip. We don't think you're going to feel the drip now because we've got you numb enough. Can you just give us an E? Keep going. E. Drip. There you go. Take a breath. So I think the really nice thing about the mist system, they don't really go through the anxiety during the numbing process. And so by the time you get to the procedure, they're really in a better headspace to undergo that. So you're really just kind of improving the entire process, not just their tolerance of the procedure, but I think the way it's going to go is going to generally go better with a less anxious patient. So far, no coughing, no choking, no discomfort there. Nice. That's what the system was designed for. So nice to see that.